The COVID-19 virus and measures to mitigate its impact have severe consequences for the lives of millions around the world. Mr. Schneider, how would you describe the impact of COVID-19 on children, and what does UNICEF project for the coming months?
Of course, this is a global crisis. It's a global pandemic, the first of its kind, and it is a health crisis. But I think 3 months into this global crisis, we must also say from a UNICEF perspective that this is also a children's crisis. And it is a children's crisis with regard to the immediate consequences related to the health and the well-being of children. And it also a children's crisis when it comes to the social consequences that also had an immediate impact on children. Let me just briefly go to the first point. When it comes to health, we don't know yet how the virus will impact on children when they are in a state of malnutrition or already at bad health. What we see already is that the whole efforts to counter the pandemic and the crisis situation we are in is already impacting on the health state of children in many countries. When we look at the social consequences for children, we already saw immediate impact in many countries in Africa, in Asia and other regions. Because parents of these children immediately lost their jobs, they lost the household income, which had direct consequences for the health and the nutritional situation of many, many children. And what we now see after a few more weeks in the pandemic is, of course, and that's a big worry for UNICEF across the globe, that children might run risk to be pushed into child labor. Families might go back to hazardous practices for children when we think about child marriage, so that children, especially girls, run a double risk with regard to their health situation and overall.
As you have mentioned, the pandemic is proving especially challenging for the millions of children who are already living in extremely poor urban areas or slums across the global south. In India, an estimated more than 8 million children under the age of 6 are living in slums across the country. Dr. Haque, how are these children coping with the crisis, and what needs to be done to ensure their health and safety during this time, especially that of girls and young women, as Mr. Schneider also mentioned?
Thank you for focusing on this, because what the pandemic is showing us is that in some of the invisible disparities that remain hidden are really coming full force and hitting us in the face. And especially when we look at the case of India today, we're close to 300,000 cases throughout the country. And of those cases, about close to 70% of them are in 20 districts which have very high urban, high-density settlements. So a huge burden of this is in already populations who think of the living conditions in a slum where you cannot social distance, where you do not have access to the proper hygiene measures that you need, where children are vulnerable to disease, they're vulnerable to malnutrition, they're vulnerable to violence in their commune. And so it's really important that we pay attention to this. We also need to understand that slums are not homogeneous. Every slum is different in a way. The people coming together are different, and many of the slums are of migrant workers. And that's another issue that has come to the forefront. You know, we estimate that over 1 million migrant workers are on the move just from Mumbai alone, which is one of the worst hit areas. And many of the migrants are children. And in many cases, we've seen that, 5 out of 10 migrant girls are actually migrated because they have been married off under the age of 18. Mm-hmm. So within this situation, as it is, they are vulnerable, plus the stigma that we see associated with the COVID-19 pandemic. They bear a much wider burden of that, or a much wider share of it. And so we have had to work very closely with WHO, with local NGOs, with the municipalities to focus on areas that we haven't necessarily delved into as much before. As Christian said, children, we are still hidden in a way, but we know the impact on them is going to go far beyond the immediate of this pandemic, especially girls. And thanks, Christian, for highlighting the plight of girls, because what are the coping mechanisms of poor families? We know it. It's either children going into labor or girls being put into marriage as a way of the family coping with it. Today is the World Day Against Child Labor, and UNICEF and ILO have come out really to focus on how the pandemic is likely to push many more children into labor situations. So it's important that we look at the social protection systems that support universalization of schemes, that don't spend too much time in looking at targeting, that determining who are the poor, but really look at all children are at risk, all children are vulnerable, and we need to put in place those systems that support them.
Mm. And if you maybe allow a short follow-up question, one issue is, of course, education. And then for these millions of children, there is also a huge gap in access to, for instance, digital opportunities. What can be done in slums or these areas for these millions of young children to get access to education during these times?
Right. And, you know, we're in a situation now where we estimate we're reaching about 33 million children with some form of remote learning. What we are also seeing is the disparity is growing. Children who have less access to digital technology, which are children who are poor, whether they're in an urban slum or whether they're in a rural area or in one of the tribal areas, those who are disadvantaged are getting left further behind. So it's going to require a lot more for us to pull them back. Schools in India are not going to be opening till after August, which means for months, some children will not have had access. So we're really trying to look at, is digital learning the only way? What other means can we be putting together? How can communities in smaller groups bring children in smaller numbers to keep the learning opportunities going? So it's really challenging us to think beyond the norm also. It's easy to say digital learning, but when we look at the digital divide in countries like India, where especially girls are left out, where especially the poorer sections of society are left out, what other means can we do to level the playing ground? And we don't have the answer yet, but we're trying to pull people in. We're trying to look at good practices in different places to see how we can make this work.
While most governments around the world and the international media are focusing on managing the economic and health crisis posed by COVID-19, prolonged conflicts, wars, and the situation of millions of refugees are in fact overlooked. Mr. Schneider, how do you assess the situation of children living in these affected areas, and what specific challenges are they facing?
Let me just name again the risk that UNICEF is seeing right now. We fear that towards the end of this year, every day, 6,000 additional children might die because of the health and nutrition consequences of the pandemic. We fear that more than 86 million children might be further pushed into a situation of poverty. And as Yasmin was zooming in a bit into the situation of children in very vulnerable settings in India, I think it's really important to see that, as in many crisis situations, the most vulnerable children are really those in conflict areas, in refugee settings, which are, again, millions and millions of children. if we think about these situations between a region like Syria and the neighborhood, the Rohingya camps in Bangladesh, or a number of settings in African conflict areas, all our measures, beginning with the issue of education and digital education, up to the very basic health questions, are being jeopardized now. If we think about our basic hygiene measures, to keep the distance, to wash your hands, just imagine how a young girl or a young boy in Eastern Congo or in Cox's Bazar in Bangladesh should follow those rules. We need really to invest more and to take care. How can we reach these children? How can we reach these families with the important messages, and how can we boost our efforts in a setting that also for UNICEF and our many partners in these settings is a really big challenge. Even in normal times, it's hard to reach so many families under these circumstances, sometimes also with a big risk for those who want to help. That is now particularly difficult and different from the initial setup.
As you both mentioned, this is an international crisis, and the world needs to come together to successfully overcome it. But international solidarity and joint efforts are thus more urgently needed than ever before. But at the same time, some countries are, especially now, turning their back on global cooperation and are even questioning the effectiveness of the UN system. Dr. Haque, how do you interpret this course of action? And in your opinion, what needs to be done by the international community to successfully overcome the pandemic and this crisis with its many challenges?
It's really important that we keep the focus on children and how children are going to be affected unless the world comes together for them. Because when we talk about children, especially the young children, what we do today is going to have an effect years down the line. If we neglect the nutrition of a child today, we're neglecting the human resource and the human capital of the world. With the years of effort and investment that has gone into reducing under 5 mortality, improving learning outcomes on early childhood development, we risk to lose all that if we don't keep the investment going, if we get fragmented. And I think our Secretary General has said it, the world is facing a global crisis like we haven't seen in the 75 years history of the UN. It's killing people, it's spreading human suffering, and it's upending people's lives across the world. No country, no population group is spared of it. And this is where no country can fight it alone also. And instead of the fragmentation, what we need is solidarity. We need continued leadership. We need transparency. We need trust and cooperation more than ever before, whether it's across borders or within our borders. And for that, I think the UN, the hope on multilateralism has to remain. We have to keep steadfast in it. We cannot give up on it. I think what I'd also echo is our executive director's words when she said that, this is an extraordinary response which needs all hands on deck. And it means individuals, corporations, foundations, governments, and all organizations. So it's not just the UN or just the government or just agencies, but private sector, corporations, everyone has a stake in it. And we all need to come together for that. So what the hope, and that's what we have to keep alive, because we have to show that concerted action makes a difference, that we have to keep the focus on addressing the issues, and we have to keep acknowledging the interdependence between people. There is no separate global south, there is no separate global north, we're all part of it. And we need to stay steadfast in that direction.